Okay, are you seeing it?
Yep.
All right.
Beautiful.
Perfect.
We'll give everybody just another minute or so to come in and then we'll get you started. All right, good morning and happy Wednesday to everyone. We are going to go ahead and get started today. We have, first up, we have Miss Monica. She is from Minnesota Ag, and she's going to be our first speaker. We have two speakers today. Because of the holiday, I had a little bit of trouble getting a third speaker, so we have had a big response to our FarmResponse program within AgriSafe. So we're going to fill that spot in as the third speaker today. So Monica, I will let you go ahead and get started. You can introduce yourself. And then if anybody has questions for Monica, go ahead and enter them in the chat, or you can hold them and then just unmute whenever she's finished. All right. Thanks, Monica.
Awesome. Thanks for having me today, and always happy to talk about this subject. So just as a way of introducing myself, I grew up on a farm in northwestern Minnesota. It's currently a 5th generation farm operated by my parents, my brother, and my son. And so I did the 4-H, the FFA, all that good stuff growing up, showed dairy in 4-H, but we didn't dairy. I just couldn't handle, I was one of those kids that couldn't handle the thought of, bonding with a beef animal for 2 years and then eating it. So we went the dairy route and bought them as milk replacer calves and sold them as bred heifers. So after school, I went to college for psychology and then a master's degree in counseling, and have worked in rural areas really for the past 27 years in different aspects of the behavioral health field. So the first 12 years, I did direct service work with kids and their families. And then I went into some administrative roles, was the director of a mental health agency. And then a couple of years ago, I started doing work in the farm stress realm. And it started, I was the director of business development at Prairie St. John's, which is a psychiatric inpatient hospital in Fargo, North Dakota. And I started getting requests to do some work around mental health in the ag community because we were seeing an uptick in suicides among farmers and farm family members. And so that led to a lot of doors opening. And then in October of 2019, I signed a contract to join Ted Matthews in Minnesota to become the second ag mental health provider that's legislatively funded. So I just wanted to talk a little bit about my work, especially around that Minnesota contract and how it really has removed barriers when we look at farming and ranching and mental health services and how to serve them in the best capacity. I think the program here has really jumped hurdles to make that happen. So I just want to talk a little bit about my work and answer any questions that you guys might have. So the Rural Mental Health Program, and we just recently changed the name to the Ag Mental Health Program because it better fits the work we do. It is legislatively funded in Minnesota. So the funding really is part of the ag budget that comes out of the ag committees. It's renewed biannually. It's considered kind of like baseline funding now because it's been in the books for so long. So we are very blessed to have that. They just added the second person, like I said, which was me in 2019. So prior to that, Ted was really handling the whole state for years, many, many years. And so now we kind of have this division, although even though I'm in the north, I serve primarily north and central Minnesota. He serves primarily southern Minnesota. I definitely have clients in the south, especially females that would just like a female to talk with. And I know he has clients in the north, so we just make it work. So once the legislature approves the funding, it's part of the Minnesota Department of Ag budget, flows to the Farm Business Management Program. And we contract through the Farm Business Management Program, which is housed in the state college and university system. So just so people kind of know the flow of dollars and how that works. So the services that I provide to farmers and their families and people that really work in the ag industry in Minnesota include crisis outreach. So if a call comes into the Farm and Ranch helpline, it's answered at the crisis center, and then they do a warm handoff to Ted or I. So they'll call us and they'll hand the person off to us. So crisis outreach. We go to the farmers. I know Ted has an office, but because of the wide area I cover, I actually do most of my work right at the farm, right at their kitchen table. Today, I'm meeting with a farmer this afternoon out in the field because he's spraying, and he said, just come out here, I'll pull over and we can talk right there. And so that's a huge removal of a barrier, is meeting them where they're at. Sometimes farmers aren't comfortable meeting on the farm for whatever reason. We've met in parks, in churches, in coffee shops, whatever, in extension offices. It's kind of whatever works for them. I also do a number of sessions virtually and also by phone because I'm available. They can call anytime. Another service in the contract includes providing farmers with mental health outreach materials, which I'll talk about a little later. We provide support for the farm business management educators. We know that in this field, people in ag industry who work with farmers are working with chronically stressed clients day in and day out, which takes a toll on them as well. And so I do work with people in the ag industry on like burnout, compassion fatigue, how to work with chronically stressed clients, things like that. Provide mental health support to post-secondary instructors and ag students. So these would be the FFA advisors, the ag teachers in our high school and college systems. Collaborate with local authorities for emergency contacts. So if a call comes in from a client that's 2 hours away and they are suicidal, we know that we access our mobile mental health team or the sheriff's department in that county. So we have a good working relationship with those folks. And I do a lot of public presentations and training as requested by the Department of Ag, Farm Business Management, the Farm Advocates Program, whatever entity in Minnesota really asks for that help. I provide that. And I do work with individual farmers, male, female. I use the term farmers and ranchers interchangeably. In Minnesota, we have more farms than ranches, so I tend to go to the farm word versus the ranch word. So I work with individuals, couples, multi-generational family units. So this comes up a lot with succession and transition planning on the farm, which is many of my clients right now. I meet with them, or they reached out due to the stress of navigating that process and all of the things that come up for each generation. It's a very unique experience, and there's a lot that goes into that. I have farm youth on my caseload, partners, so siblings that farm together, neighbors that farm together, and then of course, ag business sector and farm business management. The common issues that I see, which will be no surprise to this group, is there's a whole lot of stress out there, right? The anxiety, the depression, adjustment issues. My primary, when people call me, the number one reason is around relationships, though. Their relationship with their spouse, their parents, their kids. And it makes sense when they're living where they work, right? And working where they live, and they're working with family, and there's all of that built up stress and tension. It comes out in relationship issues. Lots of grief and loss due to a variety of things happening, not just deaths, but farm accidents, injuries, the sale of the dairy herd, no one being there to transition the farm to, a lot of grief and loss issues in farming. And then of course, the transition and succession planning that I talked about. And with the average age of our farmers being around 60 in this country, that's a common issue. I actually meet virtually with several farmers out of Minnesota to navigate transition and succession issues around the relationship side and the stress and communication side. All right, so barriers, and I'm going to whip through this because again, this is not news to you all, but when we look at barriers for our ag folks, our producers having access to mental health services, one of the primary barriers is accessibility, that they're not, mental health providers aren't available in rural areas. Farmers and ranchers are less likely to take the time to leave the farm, drive for an hour, talk about their emotions for an hour, drive back home for an hour, and we've been gone, half the day. And the whole time I'm thinking about what I should be doing instead of this. And so just the sheer nature of workforce issues and being in underserved areas and accessibility is a tough one. Teletherapy has bridged some of those gaps. However, I do have clients that there is no way we can do teletherapy because of broadband issues, because of technology issues, because they are not comfortable with technology. A lot of the older farmers I work with have hearing impairment. And so even though it bridges a gap, there are definitely still some barriers using teletherapy with our farmers and ranchers. And then of course we have the insurance issue. If there is insurance, it comes with very high copays and deductibles, which is another really great thing about this program because it's free to all farmers in Minnesota. And so there's no paperwork, they don't fill anything out. It's like somebody could call me today and I could be there, in a day or two, or we can just spend time talking on the phone today and there's no billing involved. So it removes the barrier of accessibility. Availability, we talked about that, chronic shortages, especially as you all know of like psychiatry, those more specialized behavioral health services. I would also add to that one of the difficulties in rural areas is even if there are therapists, many are just not trained. I call it agricultural competence because it is like its own competency that we don't always recognize. And I would love to see training programs or training in counseling programs and social work programs for anybody heading into rural areas, that they have some training component in agriculture and becoming more agriculturally competent. Because what I hear from farmers is if they do make the decision to go and they don't feel understood, they don't go back. So I do a fair bit of training as well with rural mental health providers and rural healthcare providers, both, so that they have a sense of when you have this person sitting in front of you, these are some of the unique stressors and dynamics that they're dealing with. And then of course, acceptability, we are making progress, much because of exactly what you all are doing here. It's embedding a discussion about stress and mental health into ag, and it really is permeating all sectors of ag, and that's what we need. I mean, that's what we need to address stigma and for it to rise to the same comfort level as us talking about our health issues. And so we have a ways to go, but we're getting there. Another really interesting piece of mental health in ag in these small rural areas is that you can't be anonymous, right? And so in an urban area, if you go seek out a therapist and you're parked outside of their office, who knows? There's just so many people. But in rural areas, people they know what you drive, they know who you are, they knew your grandparents, they know your kids. And so there's this knowledge of very personal things, which to farmers leads to a whole different discussion and thought process. Like, I can't let people know I'm struggling, or they're going to go to the guy I rent land from and they're going to, say, so-and-so is struggling. I'll pay you however much more an acre and I'll be a safe renter. So there's a lot of things around stigma that keeps our farmers, ranchers from reaching out, not even to mention or touch the surface of them feeling like they can really solve their own problems, because that's what they do. All right. What I have found most successful, and this is a question I get a lot, is how do we get the message out to our ag communities? So when funding kind of flowed into some states within the past year to do work around mental health and ag, I got a lot of calls just about like, we put it out there, we thought our phones would be ringing off the hook, and it's like crickets. Nobody is calling, the farmers aren't calling. We tried to do this farm stress event, nobody came. That's reality. It just really takes time. So the last couple of minutes here, I just want to share some things that I've experienced that have been successful at really initiating contact with farmers and ranchers and kind of permeating their environment, if you want to say that, so they know about the service. So it is truly about partnerships in these small rural communities. I have two examples. One, I got a call from a really, it's a frontier county way up at the Canadian border. and it was their soil and water conservation office, wanting to do something to address farm stress. And my first advice was, don't call it anything about farm stress or mental health. We're just going to kind of slip that in the back door. And so we kind of worked together, and it was really an awesome thing because they called it a farm financial workshop, which farmers and ranchers came to. It was at the city hall. They offered free lunch, and they had other like providers around the room that had little tables. So public health was there giving blood pressure screenings, and insurance agents were there, and lenders were there. And it was a safe place from a stigma standpoint for farmers to attend. And so someone talked about the new farm bill, someone talked about marketing, and then I talked about stress and mental wellness, and then they served them lunch. And so it opened up doors. And at the lunch, they had little conversation cards, and it got people talking. And so that was an example of kind of a community coming together to make it really an all-inclusive or holistic meeting that was marketed as a farm financial workshop. Another example I have was in this really little town in Stearns County, Minnesota, and the fire department wanted to do something around suicide prevention. And so they called me. I'd just been trained as a QPR instructor, and there had been some farmer suicides in their little community. And so the fire department initiated it. They held it at the parish hall, and I tell you what, the whole community was there. Every aspect was represented, from like the mayor and the priests were in the front row, and there were kids and teachers, and the community was very well represented. And it was everybody coming knew it was about suicide prevention, but because it was such a community endeavor, because it was sponsored by the fire department, it worked. So just a couple of examples of really pairing with community folks and how to hold those events. And then a lot of it is marketing. And for Ted and I, we're busy. I talk to farmers every day. I'm on farms a lot. And it is because our state really markets us. So we're not just this little program trying to market ourselves. We have a system in the state where commodity groups and a farm business management and the Department of Ag and Extension all unite in putting this service out there for farmers. And I think that's so important, because some of the states I talk with, it's very siloed, like, oh, we have a program and there's another program here. And that's confusing to farmers and ranchers. It's like, who do I go to? How do I get to them? What, how much does it cost? And so I just really encourage states that have farm stress initiatives, just get on board and be a united front in getting the word out there. So we have brochures, we have Department of Ag they have their brochure, people can get copies, it's on their website. Ted and I, meet one-on-one with farmers, no barriers. We have the Farm and Rural Helpline that people can call and then do a warm handoff to Ted and I. So it's just this like all-inclusive, we're all on the same page working together toward a common goal. Another thing I wanted to share quickly, and you all may know about this already, but there was an initiative a couple of years ago through some funding with MDA. We joined with the Red River Farm Network up in Grand Forks, North Dakota, and we did a series of podcasts called Transformation. And whenever I get a call from somebody saying that they're worried about somebody, they don't want to talk, but they're struggling, I point them in this direction, because it's podcasts it's farmers talking about their struggles. And it's, everything from suicides to accidents to marriage issues. loss of a farm, lots of different things. They're only like 20 to 30 minutes. There's probably around 30 of them, and they have been pretty wildly popular because I think it's helpful that farmers hear from other farmers. So I drug my dad up to do an episode, which he was not excited about. But in the 80s, he sought out a therapist when stigma was high and he had to walk through the county courthouse to get to the therapist that was there once a week. And so I'm just going to play, if this works, a little clip. I'm going to share my sound. I hope I'm not taking up too much time. A little clip of that podcast.
This is Transformation.
If you
During the
can't hear
farm
it,
crisis
let me know.
days of the 1980s, Bayou, Minnesota farmer Doug Kramer took the proactive step to meet with a therapist.
Well, there was a fella younger than me who was a salesman for farm equipment, and he told me he was going to a therapist. And at first I thought that was kind of a waste of time, but he said how much it helped him, so I thought I'd try it. And the first few times I went, I kind of felt like I didn't want nobody to know and nobody to see me.
Right.
But then after a couple of visits, so I guess I didn't care if somebody seen me. I knew I needed help.
When stress becomes too much, take that step to find help. This is Transformation.
So that's just a little snapshot, but I think that's powerful. And I have head farmers listen to those podcasts and call me because it's like, okay, someone like my dad can do it and take that step. So I can too. It's almost like it frees up the path, right? Another thing I wanted to share with you guys is on monthly, on the third Monday of each month, I do facilitate a suicide loss survivors group for farm-related people. And it's really open. I mean, it's not just Minnesota, it's open. I have people from Illinois and North Dakota that tune in. But these are people who've lost someone close to them to suicide. Some of them continued farming. Some of them, it was their dad who was a farmer, or some of them farm and their son died by suicide. But the beauty of it is there's understanding in the group because they're all somehow related to the farm and they've all experienced this traumatic loss. And so it's been really an awesome experience and honor to facilitate the group. So if I do have a registration process, just to kind of make sure we're not getting like media logging on to hear the stories or things like that. So feel free to share this if you know people. It is a hard group to attend. A lot of people register, a lot of people ask, and I never see them pop up in a group, which is okay because they will come when they're ready. It's an emotional, exhausting topic for them to discuss, but know that that is there if you know someone and would like to refer. All right, this is my contact info. Feel free to reach out at any time if I can be of help. If you're working with a farmer and just want to debrief or problem solve or brainstorm, I'm available to assist.
Monica, I think a lot of people would be interested in that link for the bereavement. If you're able to, when we're finished, go ahead and post that in the chat. I think that would be really easy for people to click on. You had so many things in there that I was like, man, you are like a walking advertisement for QPO. It's perfect. And I love that you two are out there doing that work within the healthcare community. We had a question in the chat from Mark. He wanted to know, what is the budget amount for Minnesota, because they're looking at that in Pennsylvania as well.
Well, I don't know the exact budget amount. I believe it's probably around 250,000 a year. And we have actually recently, starting just July 1, they changed the contract a little bit. So now we're contracting through a regional community development organization instead of the college university system, because there was some, I don't know, some contractual thing that just made it difficult, but the terms are all still the same. I just didn't want to make it too confusing for everybody, so I left my slides the same. But yeah, I want to say it's probably like $250 a year. It would be, you know, we could dig through the legislative notes and find the exact amount, but if that helps, or contact me later and I can point you to my contact at MDA.
Okay. Heather just posted a question. She wanted to know if your trainings are open to all professionals, because she would love to learn more.
Yeah, absolutely. And actually on my website right now, I have a contract with North Dakota to do a number of trainings, and they're not all related to ag, but there's definitely some ag trainings on there and there's no cost. So check out my website, see if any of those are interesting to you or kind of are what you're looking for. But yeah, feel free to reach out to me. I do trainings. I mean, I've done trainings for agronomists, crop insurance salesmen. I would just presented in Wisconsin for Purina dairy consultants. I mean, it's because the beauty of it is farmers are very isolated, right? And when they're struggling, they tend to isolate even more. There are a few lucky people who can invade that isolation, and it is the milk truck driver, it's the agronomist, it's the crop advisor, it's the, you know, the lender on some level. I mean, there are people that have access to that farmer even when they're struggling and they don't want to talk to a counselor. So the goal is to really arm those folks with information around what to look for, what are warning signs, what do you do when you see them. And a perfect example, I spoke to a group of agronomists about, you know, agricultural competence, warning signs, things like that. I talked to them about compassion fatigue and taking care of themselves. And then they had my info. And I got a call from a guy who's really worried about his brother. And he said, yeah, my agronomist gave me your information the other day. I was like, oh, it worked. And it does. And it's helpful to the ag industry folks because they see the hurt and the despair and the hopelessness when they go visit with these folks. And it's helpful to have something to give them, or, you know what, I met this lady, give her a call, she can help you out, kind of a thing. So yeah, anything, I'm definitely available for trainings.
All right, we'll let you go ahead and put that link in the chat, and then maybe like your email too, and that way if people have questions, they can just click right on it. I believe that in the chat, you guys should be able to talk to each other. So if you do have some more questions for Monica, go ahead and send them to her directly or to her email. And then Monica will let you go ahead and stop sharing, and we'll let our next flash speaker, Miss Soni Cochran, go ahead and share her screen, and we'll let her introduce herself.
Okay, let's see if we can get this going. Thank you so much, Monica. Really appreciate listening to you. I hear a lot of parallels with what we're doing with Extension as well. So great job. All right, we're gonna, what do you see?
Yep, I see your PowerPoint.
Oh, you do? Okay, real good.
Looks good.
Okay, you getting presenter view or are you getting the slideshow view?
Presenter.
Okay.
Yeah, it looks good.
No, we're getting the slideshow view.
Oh,
You are
slideshow.
Okay, good. 'Cause I
Thank
was
you,
like, I'm
Dawn.
gonna have to figure that out. Okay, really good. Thank you very much. My name is Soni Cochran. I am the interim disaster education coordinator, and I've worked with community engagement and wellness, focusing especially in rural areas. And we're going to do a little review. I hope this is what you want, Carrie, of what Nebraska Extension is doing. And that's why I said I loved listening to Monica, because I can hear a lot of the things that we're all working on when we talk about mental well-being in rural areas. I grew up on a farrow to finish hog farm with 6 siblings, mom and dad. Dad worked full-time in town and came home and got on that $400 combine that was full of duct tape and baling twine and made it work. So we went through a lot of those struggles a lot of other farm families have gone through. And I think that experience and that awareness of, we talk about stigma and some of the challenges being isolated as a farm rural community touch us deep in our hearts. A lot of passion with that. We've had neighbors who have ended their life by suicide due to the stress. My brother last year ended his life by suicide. So there's some really important work that we continue to, we need to all be doing as we work together. In Nebraska Extension, for those of you familiar with Extension, we are in all 93 counties of Nebraska. We live there, we work there. We are some of those folks that people come in contact with on a regular basis. So for us, it's really important with our efforts that we work on what we're best at, which is outreach, education, engagement, and then focusing on our own colleagues and professionals within the university system to improve their capacity. And again, those partnerships, whether it's a disaster event or working in these communities, it's a lot about partnerships and collaboration and working together because we can't do it alone. We just can't. So let me see if I can make this thing work now. Okay, so very quickly, here are some of the programs we've been working on. In the central part of it, we do get some funding and with collaboration, but this is kind of our focus that when it comes to mental well-being that we've been doing the last couple of years. Actually, we started working on mental well-being was several years ago when the ag economy kind of took a downturn. And then Nebraska in 2019, like many of our surrounding states and other states, had that border-to-border flooding disaster. The next year was COVID. And then we continue from there as stressors have piled up on families. So one of the projects I was involved in is the Wellness in Tough Times project. And this project, the design of it was to give hope and resources to Nebraska communities that were part of a pilot project. Now, these projects were in communities that were affected by the 2019 flooding disaster, which wasn't just a one-time event. It went all through the year with limited resources for recovery, which included they were probably not in the news like some of our other communities. We were supported by the Peter Kiewit Foundation, the Center for Disaster Philanthropy, and what we have is the Extension Foundation with some of our projects. So at that time, our focus was on outreach, getting into the community, providing some of the PSA messages and podcasts as Monica shared so great with your dad. We did direct mailings because we knew in these rural areas, not everybody had great broadband service. So we had to find a way to fund these Start the Conversation bulletins that had tips and resources for families and ideas where they could reach out to folks. Again, trying to find those other ways of doing it because of the stigma of bringing your pickup truck into town and everybody knowing your red pickup truck where you're going to be parked was important. So we sent those to 7,000 households in these communities that whether it was a P.O. box, a box, or their rural route address so that they could all get those. We also went to where people were. Husker Harvest Days in Nebraska is a huge ag show, and there are thousands of people that get there. One of the things we did, and you'll see the photos there, we had a booth, but we also had this, we were really surprised how farmers and their families lined up to take this survey using this little iPod, these little pads, these iPad little pads with these little tools that you could use to touch the buttons. There were times that we had to help some of our gentleman farmers whose hands were so big that they couldn't exactly punch all of the buttons that they needed to for the survey. But we thought maybe just the women, the female, the young people would do it. But the number of men that did this really was inspiring, that they wanted to tell their story. they wanted to share some of those things, and it was a very comfortable way to do that. We were able to collect data from those surveys that we were able to use to decide what was the best way for outreach, and ranked highest for our programs were extension programs and then radio. Getting those podcasts, getting those messages out on radio stations were really important to our rural communities. The other thing that we did is we compiled, again, a list of resources for people to use. Now, one of the things that we do know is that not everybody is going to call a hotline number. They're not comfortable doing that. They might text. We have these wallet cards, which were very popular. And I think we printed 40,000. All those have been basically redistributed. We've redesigned them, and we've added the new 988. That's going to be the universal number that comes out nationwide July 16th to reach the National Suicide Prevention Lifeline. So that 988 number is going to be on there. And what we did is we placed these wallet cards in little holders in cafes, in restrooms, at events. We didn't just have them on a table for people to pick up. As we visited with people at events, we never said this was going to be something that you, when we talked to them, you might need for yourself. We suggested they put this in their wallet so they could help someone else that they might think need help. It was never about them. We had a better time, easier time having people accept something like a wallet card with these numbers in it if they knew it would be possible to help a family member or a neighbor. It wasn't ever about themselves. And again, it goes back to that farming culture, which very much reminds me of working with veterans, which we also do, which very unique, very special, and it's understanding how to reach those folks where they are. One thing I do now as well is when I give a program, and I suggest other people do this, is I add the National Suicide Prevention Lifeline phone number. I will add the 988 to my signature block at the end of programs when I talk to people, because it's my hope if people can actually add that to their phones, people who are in crisis or who might be helping someone in crisis can get that number easily because it's already in your phone as a contact. One of the other programs is pretty neat that was actually going on prior to COVID and as we got started with the 2019 disasters is in one of our communities. It was Buffalo County, which is the Kearney area in the central part of the state. They worked again with the community foundation, those community partners, to have a neighbor-to-neighbor program. Basically, it was a program the community got together. They developed these resources, and then they organized events, very much like a tailgate. They came together, they had food, they had opportunities for people to have conversations. It's not like they had a lot of people there that were going to specifically talk about mental well-being. It gave people an opportunity to come together and have conversations. And then those conversations just kind of organically happened because that was the focus of these organizations coming together. They continued, they had packets for people to pick up, they focused on businesses. It was really a successful program. And what's interesting about that is the Wellness in Tough Times project incorporated that neighbor-to-neighbor concept into our programming in communities. And we had the opportunity, it was last fall, to visit with teams from Australia, very much extension-focused teams from Australia who adapted not only the wallet cards, but they created a program called Tailgate for Mates. And the reason it's Tailgates for Mates is their focus were on men coming together and having these same conversations, bringing them to where they felt comfortable, where there was food and barbecue, to have these conversations. So, and part of that project, we have a Wellness in Tough Times toolkit. It is an e-flipping book that is online. This is where we've shared some of these resources and stories. on lessons learned. We do share the Tailgate for Mates program in there and how they've developed their resources. It's available online for free, can be shared, can be printed. We worked with the Extension Foundation, and it was part of a new technologies and agricultural education project. So another project that we have through Extension is Read for Resilience. It actually built on that now. There is a disaster-focused Read for Resilience program. And what our Extension professionals have done is they have identified children's storybooks, literature as a way for caregivers to help children heal when they're coping through stressful times. So the books have all been identified. They have storybook guides that caregivers can use and can print off offline. Trying to think of, I can put the website to where these are in the chat box when we're finished here. But we've now converted this to kits that go out in disaster impacted areas that are given to early child care providers who can immediately start using the resources in these books with the children in their care after there's a stressful event. So the books are as cost for the books. We did have a grant program that did support some initially, but the storybook guides and the recommendations, those are all free. Now that was another project with the Wellness in Tough Times group, is we put free little libraries in each of the 7 communities and provided all of these books to those communities so that they would have them on hand, either in that free little library in town or in their local library. Okay, another project that we're involved with is the Nebraska Needs You campaign. This is actually a youth-focused campaign with the University of Nebraska Public Policy Center and other organizations that are focused on youth suicide and awareness. So there's a lot of messaging with a lot of partners, and the focus is providing hope and resources and messaging out. A lot of social media is used for this. The statewide campaign was, I guess it was promoted by the governor's wife, the Nebraska First Lady, Suzanne Shore, because she was concerned about also in suicide attempts made by youth. So this task force was put together. This was the 2021 media campaign, and it is now transitioned to 2022 with more of those messages going out as Nebraska continues to work on their updated strategic plan. Communicating with farmers, and in the western part of the state, we say farmers and ranchers under stress, because again, it's understanding the community. Our ranchers don't consider themselves farmers. So out in the western part of the state, we have communicating with farmers and ranchers under stress. And again, this is a workshop for those ag professionals, as Monica talked about, who are working with farmers and ranchers on a regular basis. And so what we do is we connect with a bank, a USDA organization, Farm Service, those organizations in the town to organize this event, promote it, bring together their professionals, provide that lunch. Again, those meals are so important to bringing people in, to provide training on not only suicide awareness and prevention, but just on overall stress in the farm community and those things to watch for and how stress manifests itself in the body. So this has been a really important program for us, because we are reaching those people again who are reaching those farmers and ranchers, those people that they trust in the community. I think about the veterinarians and the challenges that they have faced. When we were working on the Wellness in Tough Times project, we visited with a veterinarian, one of the communities, Lynch, and she said that even a year later, the challenges that they faced, children, others in the community, watching what happened with their livestock during that time in the struggle, it's very real and it's very hard. And trying to get those folks to make that connection to go get help, like Monica's dad, is so important, because that's a real story. they know that others are doing it. It'll open up those doors for them wanting to do the same. We also are now, Nebraska, like many other states you're familiar with, had some disasters this spring. We had wildfires in the west part of the state in areas that were not as affected by the flooding. So this was all new to our folks. So we are organizing, communicating with farmers and ranchers under stress sessions in that part of the state. Last week, I'm also a QPR instructor. Last week, I provided QPR gatekeeper training in the Holdridge community, a rural community. And again, it was the faith-based groups, people that were there in attendance. For our colleagues, getting that word out about suicide awareness and prevention so that we have more people in the community trained to be aware of those resources that are available and provide hope for folks. Next couple of weeks, we'll be working in Valentine, Nebraska in the public schools providing QPR training. We have 3 instructors in Nebraska Extension. In Nebraska, public school teachers are required to have this training, whatever it is. It doesn't have to be QPR. It just needs to be approved suicide awareness and prevention training annually. Okay, we have Women in Ag. We have Learning Circle guides. This is again talking about groups getting together and having those conversations. And these learning circles bring together folks who have these conversations and practice this learning to be resilient. It could be talking about financial management, human resources, marketing, legal issues, how to do some problem solving, those decision-making skills. Again, it very much ties into what Monica was talking about that they're doing in their area. We also have a Rural Family Stress and Wellness Collaborative Group. We formed this in late 2019 because of the stress that we were seeing in these rural communities. And again, we can't do this alone. So we have this group, this organization, and oh my gosh, it's a whole diverse group of people, anywhere from healthcare providers to behavioral health therapists, to those that are in the industry. They might be USDA folks or extension folks. They are those specialists on campus. We have people in the group that are focused on veterans issues, and we meet every other month to do updates. For example, the Suicide Awareness and Prevention Strategic Plan that the University Public Policy Center is working on with the Department of Health. We just update each other. And again, it's a collaborative partnership. And I would encourage any of you, if you have those in your states, to be engaged with those folks. Okay, again, if you have any questions, I'm available as well. There's a lot more that goes on in these programs that we can't do in this short time, but you can sure reach out to me anytime. I'm more than happy to visit. In fact, Monica, I'd like to learn more about your programs as well and see how we can help these folks in rural areas. But thank you for being here and thanks for inviting us.
We thank you, Soni. Nebraska is on top of it. You've got a ton of programs out there to help. If you wouldn't mind, I would love for you to share the toolbox link in the chat.
Yes.
I think we would really all like to take a look at that. And then just for the sake of time, I'm going to have everybody post their comments or questions for Soni in the chat so that we can have Tara give us a quick update on FarmResponse.
Thank you, Carrie. So these conversations that we've been having are really great segues to kind of give an update and let the audience know about FarmResponse if you're not familiar with it. So FarmResponse is exactly that type of training that Monica and Soni have been talking about to improve cultural sensitivity in healthcare providers, full range of healthcare providers, from primary care, nursing, social work, ER staff, EMTs. We really didn't hold too closely with just one particular group because we felt like any contact with agricultural communities with healthcare professionals was going to be critical. And when the work started back in 2019, the big question that AgriSafe had was, okay, we're going to try to work to decrease stigma, improve health literacy about stress, try to get people to access care. Well, what's going to happen when they meet a healthcare provider and that healthcare provider just doesn't have, the understanding of what these individuals experience on a daily basis? And how could we do something to improve that interaction? And that was where FarmResponse was born. So we started the work in 2019. It took us about 2 years. We brought in experts in the agricultural farm stress areas. And those experts were the ones that developed this content. I just served as the lead in order to facilitate the development of this project. FarmResponse is on demand and virtual, and a very interactive platform called Articulate, where the learner is engaged to do things in the platform as opposed to, listening maybe like to a webinar. We wanted them to click boxes, put answers. We wanted them to have frequent post check-ins after each little short chapter. We also wanted to be able to provide CEs for this for a wide range of providers, including physicians, which we have CMEs for this as well. And so that required us to really tighten up and be very stringent on the, and put some educational rigor to it. So we have pre and post test and approved learning objectives within FarmResponse. So we started in spring of 2021 and we built it out. It took us the remainder of the year. During that time, I was very fortunate to meet Cheryl Bessler at a University of Nebraska, who is an evaluation and adult learner specialist. And then we also sought outside expert evaluators, a nurse practitioner, a physician in a rural area, a dairy specialist, a social worker that works in crisis response. So these individuals, once we had the product ready for them to see, took a look at it for us and gave us really good feedback. So it was really a process that we improved the training all along the way until we did an internal pilot launch in December 2021 with the AgriStress helpline staff that were getting ready to launch the AgriStress helpline for several states in the United States. And so once that internal pilot launch was done, we did some more tweaks. I mean, we really worked hard on this and then finalized all of the expert evaluations and looked at the initial pilot data. So once we did that, we were ready to launch FarmResponse. It is a 3.5-hour continuing ed credit. The topics you see in the middle of the screen to the left are some of the topics that are covered in FarmResponse. Once an individual completes this, they not only get the CE certificate that they can use for their professional development and licensure renewals, but they also get an electronic FarmResponse badge that they can use on their signature line or in their marketing materials. The states that you see to your right are the states that we have seats for, and a very astute attendee today mentioned that we had Wisconsin listed here, and I think that was an error on our web host of putting that state in there, but I'm working on that, but I still want to have conversations with you about getting FarmResponse in the state of Wisconsin. We have additional states that are also using FarmResponse. The state of Washington wanted to distribute their own codes, as well as South Carolina. So right now we're looking at about 15 plus states that have these codes available for healthcare professionals. I also want to kind of share that we have interest outside of healthcare for FarmResponse for individuals that are just now starting out their career in ag, those individuals that may be ag lenders or those working within those supportive industries that support agriculture. And so you have all of your continuing ed information here at the bottom. So what the learner experiences, they get to register for themselves. If they get receive a funded code, it comes straight to their email. They're able to register with that. We collect demographic data on registration, which is going to be really helpful in our current evaluations that we're doing that I'll share with you. And we have a help ticket system, so someone can get help, Monday through Friday during working hours. And so we ensure that, we get back to you within 24 hours of a business day. The Articulate allows the learner to come in, do a couple of short chapters, leave, come back. They don't lose their place. So it's really good for busy healthcare professionals and other professionals that have limited time. It is an 8-chapter layout with interactive activities. The chapters, though, are relatively short because we used adult learning principles. We wanted to keep them at about 15 to 20 minutes because we wanted them to be able to absorb the information. And it also allows for reflection of what they're learning, as well as some really interesting videos that talk about the aspects of ag. The post-test, we look at pre and post-test scores, and then we have a very comprehensive evaluation. And once all those things are done, then someone is validated to receive their CE certificate and FarmResponse badge. And then once the training is completed, they also have access to reference lists, resources that we have. We developed a clinical conversation tool that helps a healthcare professional start that conversation with someone in their office if this is something they've not done before. It's suggestions on how to start the conversation, as well as building in a couple of 2 or 3 screening tools, the GAD screening tool, the short question, like the 2-question, the PHQ-2, to kind of get them an idea of where that individual sits with stress, possible substance use, and also a short screening tool for depression. Those screening tools are all evidence-based, not developed by AgriSafe. We relied on those that have already been validated. And so our public launch happened in 2022. Currently, we have distributed codes to over 29 states of individuals that either were able to get a funded seat or they wanted to pay for the training for themselves. And they continue, this code distribution continues to grow every year. Right now, we're sitting at 693 registrations of FarmResponse. We have 142 completions. And we are right now in the process of our first 6-month evaluation. We're going to be able to correlate performance on FarmResponse, knowledge acquisition, pre and post for individual healthcare disciplines. So that'll be really interesting. We ask them, what type of healthcare professional are they? So we get an idea of what their knowledge base is and their interest level, as well as do they have any experience in ag? We felt that that was really going to be critical and could play a role in their success on that pretest versus someone that doesn't really have much experience in ag. So we're really looking forward to these statistics, the statistical analysis of all the evaluations that will be pending. But we did a quick cursory on about 53 evaluations just to give one of our funders an idea of what we were seeing. And these are just basic statistics. And 68% of individuals said it would be easy to implement changes in their community. So that was positive. 91% said they would recommend it to other healthcare colleagues. And 91% of those evaluations said they agreed that their range of referrals for agricultural workers had been expanded. So I would like to invite anybody that has any questions about FarmResponse. They can certainly reach out to me. And I would also, like to kind of share, if you go to the FarmResponse page, and I will share that real quickly, you can get more information about FarmResponse. There we go. How am I doing on time, Carrie? I'm 2 minutes over.
2 minutes over. That's
All right. Thank you guys for hanging in there. But if you want more information, you can go to our webpage, FarmResponse. You can find that under Learning Opportunities here in the drop down. It'll take you to this page. Registration can happen here. You can request your free code from here as well. And then you can see all the topics that are covered. We're really looking forward to this evaluation. We're hoping to establish some evidence base with this training, but that, of course, has to be done with some rigor. So we're looking forward to reporting some of those evaluation data. Here's the developers of the content that you see, and then you can click on and you can read the bio of that individual and what their expertise is. And then these are some of our reviewers. You can also read about regarding their bios as well, and go a little deeper into the course and read the names of the chapters that are included in FarmResponse. Thank you, Carrie.
All right, guys, we are at the top of the hour. Tara and I are going to stay on for just a few minutes in case you have any questions for either one of us, but we really appreciate you taking out of your time the holiday week to join us today. It's been our most attended so far, so we really appreciate it. Thank you.
Thank you, guys.
Hi, Tara. I just wanted to say hi. Thank you so much for inviting me.
You're welcome. So Tara, Brianna's going to be one of our speakers next month.
That's fantastic. That's fantastic. Yes, you're going to love her slides.
I guess we'll see.
Miss Laura,
Hi, Lynn.
what kind of resources in Kansas are you looking for? So there's a question in the chat from Laura. If you're able to unmute, yeah, there you go.
I'm gonna log off. Thank you.
Okay. Hi, Brianna. Hi, Laura.
Hi. Here, let me turn on my camera so you can actually see me. This is fantastic. I absolutely love this. This is great. I work for the USDA as a veterinary medical officer, and just find this information super fascinating, and really think that veterinarians could probably play a bigger role in that. And I know that there are friends of mine that would probably be interested in this kind of thing. I guess my biggest question would be kind of, are there other, so like, today we talked about Minnesota's resources, Nebraska's resources. Are there places to go that have these kind of resources for other, I say Kansas, but, the whole United States in general would be nice because, like, I have friends all over the place. So is there a centralized location where you can find information?
Mm-hmm.
Probably extension, right?
Well, extension and also your regions. So the SFRAN established 4 regions, and each one of those regions were supposed to be tasked with developing resources that were in those regions. So I know that I think Josie Rudolphi was here today, and if you look at the if you look at the FARSAN, FRSAN regions, and then it will give you the contact or the web link to those regions. You could probably look at their websites. I know up in Washington, the Pacific Northwest, forgive me with regards to their name, but I know they have resources that are listed. Many times they're linked to other individuals. We had, who was that on today with us? I'm sorry, names are evading me, I guess, at this time, but those regions were supposed to curate resources specific for those regions. So that at least breaks it up into about 4, okay? And I'll see if I can find a link while we're on here so you can get an idea of where to look for those. I agree, I think a national database would be fantastic, but I think the federal government, other than USDA resources that we use all the time, those more region-specific resources were supposed to be done by the individual regions.
Okay. Yeah, no, that's helpful to know. Another question I had was, especially during, this year with the HPAI outbreaks, are there resources for farmers or ranchers in that aspect? This is a highly stressful situation. Are there places that they can go or people they can talk to, or is AgriStress kind of like still that resource that farmers can use?
HPI outbreak, I'm assuming you're talking about the avian flu.
Yeah.
Okay, sorry, just a different that I'm used to.
Vet talk here.
I got to sharpen up my my zoonotic chops. Okay.
Yes.
I do know, like, for example, in the state of Pennsylvania, one of our partners there, Mark Kritz, he shared with me a really great resource that was showcasing like where outbreaks were, where they were located, which I know has to be extremely helpful for individuals that are trying to figure out what's happening close around me and is it coming, you know.
Right.
We did some initial work in avian flu. Laura, if I could get your contact, Carrie, do you have her contact?
I think because of the way that we did the meeting this time, that it saves her email in the registration link. But Laura, if you want to put that in the chat real quick.
I was going to say, I'll just put it in the chat.
Yeah, because
it's just literally my first and last name. So
okay, perfect. But I will reach out to our staff that did a lot of work in the avian, have done work in the avian flu, and see what we have, and then also ask them, you know, where would the best source be?
Okay. Yeah, no, that's incredibly helpful. I think you know, it's starting to die down now, but I do have concerns about the fall and birds migrating back south. So I think we may see a resurgence, unfortunately.
Yeah, I agree. Okay, I'm writing this down. So USDA.
Yeah, Tara, I made a note that I never even thought about contacting vets for FarmResponse or QPR. That's a great contact list to add to our database.
And Laura, I would love maybe, we would like to get this, you know, to vets. We think like it could be very helpful.
Yeah.
Now we did not get continuing ed for veterinary sciences. It doesn't preclude somebody from not doing it.
Yeah.
And I don't know the rules involved regarding vets as to how they use their professional development. So if you have any insight into that, if we could get that expanded, we talked about doing that in Georgia, but our contact in Georgia said, no, this wouldn't meet the criteria for veterinary, you know, professional development. And I don't know that area of practice like I do nursing.
That's really interesting, because I've definitely taken classes that were just specifically on suicide prevention and mental health. And so it's called like race approved classes, or CE for veterinarians. And I've definitely taken race approved classes that were mental health, suicide prevention approved. And I guess the other group that you might reach out to, just because it might be easier, would be universities. So veterinary students, I have noticed in the last probably 5 years, have become pretty passionate about mental health. And so that might be another group to reach, because then that, you know, gives you a starting point that then they continue that on even after they've finished school.
Before they go into practice. Yeah.
Right. But it's an easier place to reach.
Okay.
And I can definitely give you information or a contact, I know at K-State, just to start out with.
Okay.
Yeah.
That's fantastic. Okay, great. Well, you're gonna see an email from me. Looks like Lynn's put in resources for Southwest Iowa Extension. So yeah, and then I'll also try to find some of those links. I'll try to actually find those regional web links for you, and I'll put them in the body of the email to you, so you'll have that as well.
No, that's perfect.
Thanks for joining us.
Yeah, Laura, you've got great ideas. Like, I'm all excited now. Like, I've got a whole nother to-do list over here.
Yeah, no, this is great. This is perfect. And if I can help in any way, just let me know.
You'll hear from me.
So
Careful what you say.
I know.
Hey, it takes us all. We can't do it alone. So that's
that's
the beauty of these kind of things. So
yeah, absolutely.
Yeah.
All right. We look forward to staying in contact with you.
All right. Thanks so much. I appreciate it.
All right. Bye-bye.
All right. Bye.